Hello everyone. In this video, we are going to continue the discussion on the disorder of blood. So this is also in the categories of pathogenesis. In the previous video, we have introduced the disorder of qi and essence. Here we're going to introduce the disorder of blood. For this session, especially for the disorder of essence, qi, blood, and body fluid, often we're going to separate into deficiency and abnormal movement. So same as the stagnation of essence or essence deficiency. Also, when we talk about the qi, we also separate qi into qi deficiency and also abnormal qi movement. Here, when we talk about the disorder of the blood, we want to know what's the reason of the disorder of the blood. We're also going to separate into blood deficiency and abnormal blood circulation. So this abnormal blood circulation is similar to the abnormal movement of the blood. So firstly, blood is one of the most important substances in our human body. The importance of the blood we have studied in the previous chapters of the essence, qi, and blood the session. So we knew that the blood is one of the most important substances in our human body, and also the blood provides the nutrition of our human body. That's why the blood we also call nutrition qi, right? Part of the blood we call nutrition qi, which means blood can nourish our body. If we have blood deficiency, if we have the symptoms of certain tissues or 脏腑 organs short of blood nourishment, then we will have all those symptoms. So what's the cause of blood deficiency? How many causes it can result in blood deficiency? The first one is bleeding, hemorrhage. So the bleeding, similar to the picture on the right side, the first picture. Bleeding, we will lose blood directly, right? So that will cause blood deficiency. Blood deficiency means that we don't have enough blood, which results we don't have enough nourishment from the blood. So for this disorder, blood deficiency, we can see in two aspects. One is we don't have enough blood in terms of the volume. The other is the blood, we don't have enough nourishment from the blood. So that's the definition of the blood deficiency. The first is bleeding. We don't have enough blood, the volume. We don't have enough volume of blood in the body. And also in the meantime, the new blood, the formation of the blood takes time. So the new blood doesn't formate quick enough. So that's the first cause of the blood deficiency, bleeding. The second is you need to think about where does the blood come from. The blood comes from the nutrition qi, right? The nutrition qi is also a part of acquired qi. So if the acquired qi deficiency, we also will have blood deficiency. Acquired qi deficiency, that's due to the spleen and stomach deficiency. So the weakness of the digestive function will cause in the acquired qi deficiency, which is the source of the blood. So we don't have enough source to ferment the blood. That's the second cause. And also, if due to chronic disease also might consume the blood, because that's if it causes impairments in the body, your body needs to use blood to repair the impairments. That also will result in blood deficiency after a long time. Essence deficiency also may result in the blood deficiency. That's because the blood also can be generated from the essence. So that's from the relationship among blood, qi, and essence. So from here we will see that the blood deficiency, this symptoms or this pattern has very close relationship with the spleen and stomach or middle jaw and the kidney. That's where the essence come from, right? The essence is stored in the kidney. So blood deficiency has very close in relationship to the spleen, stomach, and the kidney. Because all our organs in our human body, all the organs and tissues need to be nourished by the blood. So if we got the blood deficiency in the body, we also can have many different kinds of symptoms, depends on which organs or which area are affected. For instance, the heart governs the blood. If we don't have enough blood, the patient may have palpitation or poor memory. Thumb pulse. So the thumb pulse can reflect that we don't have enough volume of blood in the vessels. That's why the pulse will feel very thin. Dreams a lot. Poor insomnia. So poor sleeping, insomnia, palpitation. These are the symptoms of the blood deficiency in the heart. If the blood deficiency in the liver, this will result in the symptoms such as dry eyes. That's because of the liver opens in the eyes, or the impairments of the limbs or extremities. That's because the qi flow were obstructed by the liver, because the liver regulates the regulation of qi movement, and also the deficiency of blood in the liver also can result in irregular menstruation. That's because of the menstruation is related to the liver. The blood also comes from the liver. So if the liver got blood deficiency, then they will have not enough source for the menstruation. That's why the lady may have irregular menstruation. So these are the symptoms and causes of the blood deficiency. The next one is the abnormal blood circulation. Abnormal blood circulation mainly reflects in these two areas. One is the blood stasis. The second is hemorrhage. Blood stasis, such as the picture, this picture, and this picture. So these two are bleeding under the skin. You can see bruise on top of the skin. This is the blood stasis. Blood stasis, there can be many different causes of blood stasis. Blood stasis means that the blood, the flow, the circulation of the blood is slow and the pathway, which is the vessels, was blocked, or even the blood stopped moving, such as the blood stasis in the pictures. That's the blood stop move. So the blood stasis and hemorrhage, they also related to each other. Although when we discuss in individuals, but from the cause of blood stasis, from here we're going to introduce to the blood heat or blood cold. Why the blood heat can cause blood stasis? So when we talk about the blood heat, we need to understand what's the characteristics of heat. The heat will consume body fluid. The blood is also part of the body fluid in the liquid form. So the heat, when we got excess heat in the body, especially excess heat in the blood, it's very similar. We cook with the blood. When you cook, so for instance, here is a pot of the blood, and then you got the fire underneath, which is the heat. You're going to cook the blood, so the blood here will be concentrated. Once the blood concentrates, it will be thicker. That's why the flow, the circulation, won't be that smooth if the blood becomes thicker. And so that's the blood heat. Because the blood heat will concentrate the blood and make the blood thicker. And also in the meantime, blood heat will result in blood deficiency. Because once the blood is concentrated, on the other hand, you can see the volume of the blood. We got less volume of the blood, which is the blood deficiency. So the first reason is the blood heat. The second is the blood cold. So don't be confused here. These two are exactly opposite. Blood heat and blood cold. So when you see these kinds of terms, we're going to talk a lot in future. These kinds of terms, the different terms we put together. Blood heat or blood cold. Blood cold means the coldness in the blood. The coldness of the blood will slow down the circulation. So in this situation, it's very similar. You put the blood, this volume, in a fridge or in a freezer. Do you think the flow will be good or not? So the answer is not. If the blood is too cold or even freeze, the flow won't be good. So that's once they slow down or even stop due to the coldness, it will cause blood stasis. So when we see the blood stasis, some symptoms, from the skin, only one of the symptoms, we also need to distinguish what's the cause for the blood heat or blood cold. The second reason is hemorrhage. Hemorrhage also can cause a kind of abnormal blood circulation. So hemorrhage means bleeding. So bleeding, such as the picture here, this picture, blood move out of the vessels, so cause bleeding. Once they cause bleeding, it's similar to this picture. Bleeding will reduce the volume of blood in the body, which will result in blood deficiency, right? But in the meantime, the bleeding, except the bleeding on top of our skin, so bleeding on the skin, so we see the blood bleeding out from the skin. If the bleeding is under the skin or in other parts of the body, even in internal organs, such as here, the hemorrhage in the brain, the bleeding in arteries in the brain. So you can imagine that once the patient got bleeding here, where does the blood move? Blood will stay in the brain, right? Once the blood stays in the brain, our space is limited in the brain, so this causes the blood stasis. That's very similar to this. The bleeding in the brain and bleeding under the skin or other parts of our body is very similar. These blues, this dark color, reflects the bleeding under the skin, and these indicate the blood stasis because that's the blood stop moving under the skin. And once the blood stop moving under the skin, these blood will occupy the pathways of where the blood move. So the new blood won't be able to move through here. If the blood won't be able to move through here, we call it blood stasis. It's supposed to move through all of the body, so the blood is supposed to move around. But once these pathways are obstructed by the static blood from the bleeding, it will obstruct the pathway, so it will result in blood stasis. For blood stasis, the patient may have the kind of symptoms. The first is the symptom will be pain. The pain may be fixed. As you can see, the bleeding, this kind of area will not move. Once it bleed here, it bleed here. So that's one of the typical symptoms of blood stasis. The patient may feel pain, but this is a fixed pain. This pain will move. The patient also may feel stabbing pain. That's the symptoms of blood stasis. Apart from the blood stasis, the hemorrhage, the cause of the hemorrhage is not only the cause. There's other causes can cause the hemorrhage. So what's the causes of hemorrhage? The first, blood heat can cause hemorrhage. So in this situation, why the blood heat can cause hemorrhage? That's because if your blood is hot, so when you cook the blood with the fire underneath, right? You got the fire underneath to cook the blood become very hot. In this situation, the blood will be thicker, but in the meantime, the blood also will move faster. This situation is very similar when you cook your water. When you cook water, the boiling water or rolling boil water, you can see the water is jumping. The same as your blood. If the blood goes to excess heat, blood will move faster. In the other aspects, it can cause blood stasis depends on which period. At the beginning, the blood can move faster, and in the end, once the blood be concentrated, it can cause blood stasis. It will stop. So if the blood heat, the blood move faster, blood is easier to move out of the vessel. That's because our vessel got the limiting force to keep the blood in the vessel. The force is from the qi. The qi limits the blood move within the vessel. So these theories are from the Qi. So if you don't remember the theories, you should go back to revise a little bit from the Qi theory, from the essence Qi and blood. What's the function of the Qi? Yin Qi, nutrition Qi, Wei Qi, defensive Qi. What's the function of them? That's why Qi deficiency can cause hemorrhage. So all these causes, different causes, the patient may suffer from like a red tongue or even dark red tongue, even purple tongue, the color. You can see some dark spots on the tongue. And also the patient may have bleeding. The bleeding is not only limits under the skin, it can be like a nose bleeding or vomiting blood, coughing blood, urine with blood, urination, or early menstruation. So, for instance, the period supposed to count once a month, but for some ladies they may count in 14 days or 21 days. It can count earlier than it's supposed to. So in this situation, you might consider the blood heat, or just more general, you need to think about the abnormal blood circulation. You need to think about the causes. What causes can result in abnormal blood circulation? So that's how the disorder of the blood, the causes, and also the symptoms, and which organs can contribute to these disorders. And also because blood is a kind of liquid form, nutrition Qi. Blood and body fluids, they can mutually generate each other. So blood deficiency also will cause body fluid deficiency. So they are also related. Mobility of Qi and blood. That's the next topic. This topic is also actually not only the Qi and blood, although we only mentioned here, we're going to give you some other examples that we actually discuss the relationship among essence, Qi and blood. So since we have the slides here, stagnate the Qi and blood. So we're going to start from the Qi and blood first. The relationship. Stagnation due to Qi deficiency with blood stasis. So from the title, you will see this stagnation is due to the Qi deficiency and blood stasis. So in this situation, the patient have both of Qi deficiency and blood stasis. The reason is because the relationship between the Qi and blood. The Qi has the function to move the blood, right? That's why we say the Qi can govern the blood. The proper movement of blood is related. The proper movement of the blood relies on the Qi, because we need the Qi to push the blood. If we got Qi deficiency, the Qi doesn't have enough force to move the blood, it will cause blood stasis. So in this situation, the patient have Qi deficiency and they don't have enough force to move the blood, the flow of the blood slow down, which is blood stasis. So the patient can have like a dark tongue, or dark spots on the tongue. And also in the meantime, the patient may feel fatigue, short of breath. That's the symptoms of qi deficiency. Qi deficiency also can cause the hemorrhage. So this we have explained just now in the previous slides why qi deficiency will cause hemorrhage. That's because qi lost the function of confining the vessels to control the blood move within the vessel. That's also due to the qi deficiency. The hemorrhage will result in blood deficiency, also will result in blood stasis. So as you can see here, the discussion in the previous slides, that's where we discussed the blood deficiency and blood abnormal movement is not separate. They are related to each other because qi and blood are related to each other. Qi collapse due to severe hemorrhage. The third part, severe hemorrhage, for instance, from accidents such as car accidents. So these kinds of accidents will cause severe bleeding. Severe bleeding, and then the patient will lose a lot of blood in terms of the volume. So in this situation, the patient don't have enough blood in the body, and in this situation, the qi will collapse. That's because the blood is the vehicle of the qi. The blood is the carrier of the qi. So once the bleeding, too much blood move out of the body, the qi, the blood will take away too much qi out of the body, which will cause the qi collapse, the severe injury of qi. In this situation, the patient may be unconscious, or may be in coma condition. So this is the qi collapse due to severe hemorrhage. This is the last aspect, the insufficient nourishment of vessels due to the qi and blood deficiency. This is due to the long-term disease. It can be either from qi deficiency or blood deficiency, but in the meantime, they're going to affect each other. Qi deficiency, the patient will have acquired qi deficiency, which will result in blood deficiency. That's because the blood does not have enough acquired qi as the source. So the source of the blood for the formation of the blood is not enough. Then we will result in blood deficiency. So this is the blood deficiency due to the qi deficiency. On the other side, the blood deficiency also will result in qi deficiency. That's because if the Zangfu organs don't have enough blood, which means they don't have enough nourishment from the blood, it will result in the dysfunction of those Zangfu organs, especially for the middle jaw and the axon and the spleen and stomach, which is the middle jaw, which is the acquired qi come from. So that's the qi deficiency due to the blood deficiency. So they can affect each other. And in this situation, the patient may have like pale face, pale complex, and feel fatigue. The patient doesn't want to talk. The body shape is skinny. The patient may have palpitation or dry skin or numbness in the body. So these symptoms happens in one person. These symptoms can be categorized in two, which are qi deficiency and blood deficiency. So these can reflect in the morbidity of qi and blood. So it means the disorders of qi and blood at the same time. Apart from the qi and blood disorder, the essence and qi also can happen together. That's because of the essence, qi and blood, these three also can happen at the same time. That's because the relationship, they can mutually generate each other. The qi can be generated from the essence. The qi also can nourish the essence. Blood also can be generated from the essence. We said the essence and blood have the same source. So if the qi stagnation, for instance, the qi doesn't move properly, it will cause the essence stagnation. Also, it will cause the blood stagnation, because the movement of the essence also need the qi movements, the push, the force from the qi. The blood stasis also will cause the essence stagnation. That's because, same as the previous slide, the picture there, if bleeding cause the blood stasis, some blood stop in some area, so those blood will block the pathway of qi where qi moves. Also, it might block the pathway where the essence move. So that's the essence stagnation due to blood stasis. Here, although we show you very obvious or very severe bleeding as the example of hemorrhage, or as an example of blood stasis, we do need to remember, we need to know that blood stasis in acupuncture and in Chinese medicine, it don't only refers to bleeding that we can see. It also refers to some bleeding that we cannot see, which it can reflect in the symptoms of the blood stasis, but you don't see the physical blood. This situation also considered as the blood stasis. For instance, the patient may feel stabbing pain in the joints, but we don't see the bruise in the joints. In this situation, we also consider the patient suffer from the blood stasis. So that's from the symptoms, the typical symptoms of blood stasis. In the next few weeks, when we study the diagnostics, we're going to discuss this more in details. What kinds of symptoms are related to the blood stasis. Okay, so in the next video, we are going to talk about the disorder of the body fluid. Thanks everyone.